All right, everyone. Thank you so much for joining us tonight. We're going to just go through this brief overview of the presentation about the Abbott BinaxNOW COVID-19 testing program. And this program will be recorded, and we will take some questions at the end. So to begin, I just wanted to share out a little bit about the process that we currently go through with respect to COVID-19 tracing in our schools. And I want to start off by thanking the tremendous work of our school nurses who are working so hard, really around the clock, whenever there is a positive case and close contacting needs to be done, as well as our support and treatment for those students who are positive. We work very closely also with our public health nurse, Pamela Vath, every time that there is a positive case, and really whenever new information comes out related to COVID-19 or the pandemic, our Director of Public Health, Robert Bracey, and our public health nurse, Pamela Vath, work with us very closely on all those decisions. We get updates regularly from the Department of Elementary and Secondary Education, or DESE, and also the Department of Public Health, DPH. We get guidance from them, and we work very closely with them on any updates that come out. So we weekly meet. It's a great opportunity for us to come together as town leaders, the town administrator, Michael Gilberto, the fire chief, Donald Statz, the police chief, Michael Murphy, and the director of public health nurse, and I come together every week, and we discuss the latest that we're hearing from the town, the trends, the data, and anything new that's out there in the world of COVID, to make sure that we are one step ahead of everything that's happening. And that's been going on since early in March, before this really all started to hit home. And it's been really great that we've been so proactive. So just to go over what happens when we contact trace, if we have an identified positive case, and quite honestly, even if we have a close contact of someone, the nurses begin to gather information about who, if that person were to test positive, the close contact, who they may have been in contact with in the school, so that we can then have those people quarantine as close contacts as well. So that begins, but as soon as a person is positive, the school nurse works with the school administrator, the principals, to determine who the close contacts may have been. And in some cases, we are talking to other teachers and adults in the building to make sure that we're clear on all of the places where that student may have been in the building. Especially with the younger students, it's difficult sometimes for them to recollect all the places they've been in the school, and so we have to bring in all of our adults to make sure that we're properly contact tracing. Then what we do is we call up sort of a huddle. We bring all of the school nurses, and we invite the director of public health, the public health nurse, and any of the town folks and school administrators who need to be a part of it are invited to that huddle. And in that meeting, it's usually a brief meeting, we figure out what the scope of the contact tracing looks like. And if it's a handful of calls that need to be made, then the school nurse, usually with the public health nurse, can handle that. If we realize that this affects multiple classrooms, and we need to make many phone calls, then we divide up and see what sort of supports and help is needed. And so what happens is, after the close contacts have been identified, as well as the positive individual, we guide everyone to get testing. So the close contacts, within a certain number of days after their exposure to the positive person, will then need to get a PCR test, which is the gold standard of testing. So I'm going to talk a lot about different tests tonight. And that's the process that we have currently in place in our schools. If someone is symptomatic, has any of the symptoms for COVID-19, when they come to the nurse, they are sent home and they are told to get a test right away. But sometimes those results take a few days. So we're going to go through the process and what's available to us at this time. So as I mentioned, the PCR test is the most common. It's the most sensitive and the most specific. And I think it's appropriate at this time to just remind everyone that, my background is not in medicine, and I have learned quite a bit in the last 6 months, much more than I ever thought I would know about testing and pandemics. And I appreciate that many of you in the audience are experts. And so, any questions that you have, I do have some folks, obviously, that we can bring those questions back to if I'm unable to answer them tonight. I know that Dr. Tramontosi, our school physician, is listening on the call tonight and will be there to assist me with any questions that we have, as well as our school nurses and our public health team. But my understanding of the PCR test, again, is that it tests the RNA, and it's the most common. And again, it's the gold standard. We'll say about testing. It's the most accurate. There's also antibody tests, which we've heard about. We're not going to spend a lot of time talking about those tonight. Those are usually a blood test, and they test your immune response, tell you whether you had COVID at some point in the past. The third type of test is an antigen test, and that's the test that we're going to talk about the most this evening. The test that we're speaking about was part of a large general hospital clinical study. It has a 97.1 sensitivity and a 98.5 specificity. And what it does is it looks for protein coatings to be present. So more of the virus needs to be present in order for it to identify a positive. So what you're going to see with an antigen test is if you're test positive on an antigen test, it's a pretty high indicator that you are positive because there's more of the virus present. But a negative, because it's just looking for that protein coating, a negative may be a false negative. And so there's a good chance with a negative that you still could be positive. That's why no matter what, everyone's going to still be dismissed and still be tested. But we'll explain a little bit more about what this testing opportunity would provide. So this is a little bit more. This is from FDA.gov, and this is just explaining a little bit about testing. So no test is 100% accurate. Test performance varies based on the prevalence of the disease in the population being tested. COVID-19 diagnostic tests may be less accurate in populations with low prevalence of disease and in asymptomatic individuals, individuals who shed little virus, or individuals who are early or late in the course of the illness. Tests are assessed based on their sensitivity and specificity. A test sensitivity is the fraction of positive cases that the test correctly identifies as positive, and a test specificity is the fraction of negative cases that the test correctly identifies as negative. So a highly sensitive test will generally have a low false negative rate, but will run the risk of false positives if the test specificity is low. A highly specific test will generally have a low false positive rate, but will run a risk of false negatives if the test sensitivity is low. And so again, the test that we're speaking about this evening, the BinaxNOW test, has a 97.1 sensitivity and a 98.5 specificity. So again, this is an antigen test. There's about 160 school districts in Massachusetts that are participating in phase 1 of this trial. It has low false positive results. We get rapid results and information. And this is a part of the U.S. Department of Health and Human Services. This is something coming out of the federal government. Massachusetts receives 2 million kits, and then they are then going to redistribute those kits to all different places in Massachusetts, including public schools. So what is this test to be used for? The antigen test, to be very clear, this is only used for symptomatic students and staff. This is not used for travel. This is not used for folks who are asymptomatic or not having any symptoms. This is not a test that is given widely to everyone in the community to determine whether you have a test. It's only for symptomatic students and staffs. It's a very specific purpose for this test that would be available to us. It's also not available for parents, guardians, or siblings. This is really only for staff or students who are in our schools. So again, symptomatic individuals who test both negative and positive. So either if you test either negative or positive, so both situations, you would still be sent home and you would still take a PCR test. However, and I've highlighted in green the main point of this opportunity, positive individuals would isolate immediately because you identify as positive. The contact tracing would begin immediately, and the close contacts can quarantine immediately. So this graphic really shows you the most important piece of this. Right now, our current system, if you come down to the nurse, if you develop symptoms, you have symptoms at school, you would be sent home and you'd await a test. And oftentimes those tests can take 3 to 5 days to get the results. And after those 3 to 5 days, we would then begin the contact tracing and the quarantine process for those with whom you were in contact. The green represents what the advantage would be to having the antigen test in school. If you develop symptoms in school, you would come to the nurse, you would have a test, and within 15 minutes, we would have those antigen test results, and we would be able to begin that contact tracing process immediately. So it's really pretty simple. That is the main advantage to having these tests in the school, and that is what the outcome would be. So let me talk a little bit more about the big picture here. So consent and authorization, a lot of questions around this piece. What we would do most likely is we would have parental or staff permission, and it would be given prior, so a pre-authorization, and then there would always be follow-up after testing. So again, if a student comes down and is tested, the parent would be followed up with to let them know that there was testing, and obviously they would also be coming to pick up the child to be taken home and then for further testing. They would not necessarily be contacted before every single test, because part of the reason why we're doing this is to expedite the process and to make sure that we can begin the contact tracing, isolation, and quarantine process. So that blanket statement basically saying, if my child develops symptoms and they come to the nurse, they would be able to receive this test. So that would be the process, and there would be a written authorization that would be sent home in the future. There would be opt-outs available, so if a staff or student does not want to participate in either the testing or in any data collection, so we would share whatever information would be shared and make sure that everyone's aware of what data is being collected as a part of this clinical trial. We would make sure everyone is aware of that, and you would opt out. And in those cases where anyone opt-outs, they would just follow the procedure that we have in place now, which is essentially you come to the nurse and the nurse sends you home immediately without a test. And you would get a test, a follow-up test either way. So these are some of the symptoms that are associated with COVID-19. And again, many of these, in isolation would not be a COVID-19 symptom necessarily on its own. So a headache or fatigue or some nasal congestion, for example, those on their own. But if they're in combination with other symptoms, obviously, new loss of taste or smell, sore throat, fever, cough, these are all COVID-19 symptoms that we would be very concerned about. So I'm going to say several times throughout this presentation that one of the big concerns that the state, the federal government has, and also our local team who's looked at this has, is that we don't want to increase the number of staff and students who come to school if they're experiencing COVID-19 symptoms. We don't want anyone to say, well, now that there's testing, let's go to school and see how they do, and and then they can always get tested. It's critically important that students and staff follow all of the protocols and that they stay home when they're sick. So anyone who needs to who has any symptoms prior to coming to school, you're always completing that daily health screener, and you're not coming to school if you're sick. But there are occasions when you may develop symptoms while at school, and that is the very rare circumstances when we would be able to use this test. There are not a lot of students and staff at this time that are developing symptoms at school, but there have been a few, and this is certainly going to be helpful in that process. So again, a student who tests positive would be treated as a positive case. There would be no delay in isolating that student. There would be no delay in the contact tracing for anyone that student or staff member has been in contact with. They would still take a PCR test. The antigen test is a presumptive test. It's not diagnostic. So we still want to make sure that PCR test is taken. And whether all symptoms or minimal symptoms are met, they would be treated as a positive case and managed accordingly. So even if the student only has, or staff member has, minimum symptoms and they test positive on this test, we would manage them as if they were a full positive test, and everyone that is a close contact would also be asked to quarantine. And we're really getting out ahead of that process. To date, we have not seen any evidence of transmission in schools, and this would be another tool to help us preserve that. Students who test negative would be able to return to school if they then get a negative PCR test, if they have reduced symptoms and they've been removed from school for at least 10 days. So this would, in essence, get everything moving faster to be able to allow students who are negative but have some symptoms to be able to return back to school, and for us to have them safely return back to school with this assurance of the testing negative on the PCR test as well. But overall, this also provides us more information and data for our nurses to make decisions for students and staff with minimal symptoms or chronic conditions. So when we think back to that list of symptoms, you may have just some fatigue and a runny nose. This would be enough possibly for us to do the test, but with those minimal symptoms and the negative result, we would be able to make a much more informed decision. And also, there are going to be students with chronic conditions that may have a persistent cough or something related to other symptoms or conditions that we would be able to make a more informed decision with the test results as well. So there's more for us to learn about those minimal and chronic conditions as well. So what would the procedures look like for testing? So the testing must be administered by a trained medical professional, and this includes school nurses. So in our cases, the school nurses would be the ones conducting these tests. The test would be conducted in a COVID isolation space, not necessarily, this is not the nurse's office. So in our buildings, we have COVID isolation spaces in addition to the nurse's office. These are the spaces that are designated when students have symptoms so that they're not in the nurse's office with other students. So that would be the place where the students are getting their test. The students would have, or the staff would have a test that would be a swab of the nose. This is not the invasive nasopharyngeal, very long invasive Q-tip that would go up all the way into the nose. This is not that test. This is a very small swab, similar to, you'd picture like a Q-tip possibly, maybe a little smaller, and you're about 10 seconds brushing the inside of each nostril. It may tickle a little bit, but it's not going to be invasive. It is not something that should be traumatic or very difficult for many students to receive. I think that's something for us to be well aware of, but this is not something that any of the trials have said that it's something that's difficult for young children even to experience. And as I mentioned earlier, there's a 15-minute turnaround. So those results would be back into the hands of the nurses within 15 minutes to provide even more detailed information for the contact tracing and to provide those parents or staff members that are working with the individuals who had symptoms. And again, students and staff with the symptoms go home whether they're positive or negative. So in order for us to do this, and I want to be clear, I've said this in my communications, we have not made any decisions about this yet. We are looking at this tonight, and we are going to gather more information from many different groups. But there are some preconditions in order for us to even do this testing on site. So we would need a clinical laboratory approval amendment. This is called a CLIA. We would need that process, so that's something that we would apply for and if we were moving forward. We'd also need a standing order from a physician. So Dr. Tramontosi has been reviewing this closely, and she would be the person as a school physician who would have to issue the standing order for us to receive access to these kits and to conduct as a part of this trial. We would need additional appropriate personal protective equipment. We have a lot of equipment currently, and we would need even more of this because every time you conduct the test, we would then need to be wearing and then disposing of this equipment through biohazard disposal procedures. We would need training for the school personnel. There is a series of modules that are available for our nurses, and they would be trained. And then obviously that proper authorization and consent from the students and staff that I mentioned earlier. So one thing for us to consider are what are the costs associated with this. So the good news is the biggest cost for this test is that the testing kits are free. There would be a certificate of waiver that would be good for 2 years. It's $180. The PPE that I mentioned earlier, those N95 masks, which our nurses do have, but we may need some additional masks, certainly eye protection, and then the gloves and the gowns would certainly need to be disposed of through a biohazard disposal process, which in and of itself would have a cost that we need to be cognizant of. Obviously, the resources and time for everyone, and just for the training, the testing, and the reporting of any of the data that's collected would be, there's a cost to all of that time as well. So things for us to consider. So the concerns that certainly I've heard from others as we've talked about this in our preliminary conversations, the staff and students need to continue to stay home when sick. So this would be a big piece of this. If we were to move forward, we would need to make this a big part of the messaging and campaign for the staff and for everyone, all the parents with the students, that if you're feeling sick, you still need to stay home. You should not send anyone to school. No one should come on campus if they have symptoms knowingly, just because there's testing available. That is not the purpose of this. There are some concerns, as I mentioned, about the student or staff reaction to the testing process. I am fairly confident from everything I've heard in the webinars that the Department of Ed has provided that these are minimally invasive tests, and that should not be too challenging a process. Making sure that biohazard disposal process is in place, considering the cost, the time, the resources. Obviously, the increased exposure for our nurses who would be administering these tests is a concern that we have, and we want to make sure that their time is well spent. We're already, their time is very valuable and quite consumed right now by so many things. This would be some additional work that they'd be doing. So that's a concern that we have. And then the consent, making sure that all the processes in place for that prior consent for testing and data, that we have a process in place for follow-up for every test that's administered, and that the opt-outs are obviously considered, and those folks, as I mentioned, would follow our current process, would be just to be dismissed. So those concerns, I believe we do have good answers to, but there would be much more detailed information coming out for folks to view and sign and review. So our process for gathering feedback, I did bring this first to the school nurses for their initial feedback, and there were some overall pros and cons, as I've discussed tonight. There was definitely some concerns and definitely some clear advantages that we need to weigh the pros and the cons as we make those recommendations. Our school district physician, again, has weighed in, has reviewed this pretty closely, and I do think sees the benefits of this and would support it if we were to move forward. That's my understanding at this time, but obviously there's still more investigation to be done. This was a big piece from our teachers union when we negotiated an MOU over the summer about returning to school and making sure our school environment is as safe as possible. The idea of testing, if and when available, would be considered, and so certainly, at the very least, we are going thoroughly through this process to make sure that if this testing opportunity is one that we want to explore further, we will do so. And so that's the reason why we're doing all these information forums and this careful examination at this time. But the North Reading Educator Association has preliminary endorsed this as an idea, and they do support the idea of having additional testing options at school. A preliminary feedback from our Director of Public Health and Public Health nurse was that this was certainly worthy of further exploration. Certainly some questions and concerns around cost and other aspects of the study to make sure we investigate further. And so tonight's venue, this is an informational forum for parents, families, and staff. Tomorrow evening, I will be presenting to the Board of Health, where we will examine some of those questions that they have in greater detail. The Director of Public Health and Public Health nurse are a part of that group, as well as the entire Board of Health. And then on Thursday evening, we would share this with the North Reading School Committee, at which time, if there is more information provided, I'm going to send a survey out after tonight, so I'll send something tomorrow, and we'll gather some preliminary interest from the parents and the students and the staff about whether this should be pursued, and just to get more of a sense of whether there's community support for us to explore this in greater detail. Okay, so again, the next steps, these are the presentations over the next few days. There continue to be webinars and forums from the Department of Elementary and Secondary Education. I've attended several presentations, as have our administrative team, our Director of Student Services, Cynthia Conant, and our nurses, public health nurse, and Director of Public Health, and our school physician. So I know that all those folks have been watching those webinars, and our school committee members as well have been very involved from the outset of this in reviewing some of the recorded webinars or viewing the current webinars as they're coming out. So there's quite a lot of information for us to digest, but we're all trying to stay ahead of this. If this process is approved, the next step would be to apply for the testing participation. There's a checklist, as I mentioned before, with the standing order and some of the other processes that need to happen. We would then embark in the training for all of our nurses, and then we would receive a specific number of kits. And each kit has about 40 tests in it. So again, as a district that has students who are in person in a hybrid model, we are certainly candidates for this from the state's point of view. So that is just an overview of this whole process. I hope that provided some good information. And at this time, I'm going to see if there are some questions that I can help to answer. So if anyone has a question that they'd like to type into the chat, I can try to answer those questions for you. I'm just going to take a moment here and make sure that everyone's had a chance to respond. All right. So the question I have is if the value in state and contact tracing earlier seems clear. One question: if everyone goes home regardless of the test result, how does this aid in decision making for nurses? So what it helps us with is the process for determining those close contacts. It gets us in some cases a 2 to 3 day head start on that piece. There is still an aspect of the minimal testing. I'm sorry, the minimal students of the chronic conditions that might help the nurses to make a better decision in that case. And certainly, if someone quite honestly, what we're seeing is if you're aware that there are a positive individual and you're not a close contact, and you start to develop symptoms, or you feel that you have a headache or you have a cough, you may be able to take that test, and then we would determine right away that you are negative, and that can really change a lot of the outlook for you and for those around you who are close contacts, because again, we would not be doing close contacts immediately for people that are negative. The next question is, would there be any asymptomatic testing conducted in conjunction with the contact tracing? So at this time, with this particular test, there would not be asymptomatic testing. There are other tests available that we may be able to do that. We still would have some access to the rapid mobile testing. So if there was any kind of a cluster or multiple cases in a school, we may still call in that mobile testing unit. I don't believe that this would prohibit us from having access to any other kind of testing. But at this time, there's no asymptomatic testing that we are exploring, especially not through this test. Just give another moment to see if there are any other questions at this time. Great. All right. Well, thank you very much, and we really appreciate your time this evening. This will be recorded. I will share it out. If anyone has any additional questions, feel free to send them to me. I will send a survey out to folks along with the recording of the video, just to gauge some interest, and just to see what the interest is in whether the school should continue to pursue this as an option. So thank you very much for your time, and have a wonderful evening.